Earlier, we learned about what is cystometrogram or bladder pressure studies and how it is carried out in a low-cost setting. Today, we'll discuss how it is interpreted. We said during the last class that the patient has to talk about the sensations that he feels. The first sensation when there is some urine in the bladder, then the normal desire to void, then urgency, and if he or she feels any abnormal sensations like fullness or low abdominal pain and so on. So the first thing that we interpret is that these sensations can be affected by a variety of causes. For example, if the patient has diabetes, it diminishes the sensations. So the patient can have a large volume of urine in the bladder without knowing it. Sometimes pelvic surgeries, spinal cord injuries, or any fractures, herniated discs, and even infections can cause alteration in these sensations. And these could be found during the study. The next thing which the doctors would like to interpret is what is called a compliance. We said compliance means the elasticity of the bladder. We saw last time that from the volume of about 50 to 100 ml to 400 ml, there's hardly any increase in pressure inside the bladder. This is because the way the muscle fibers are arranged, when it expands, there's no increase in pressure. But if there are diseases which cause the muscles to become thick, like if there are any cystitis or infection, or autoimmune disease or tuberculosis, then this elasticity is lost. So then when the bladder increases in volume, the pressures also increase. And depending on what type of disease or involvement, there are various patterns which occur in the way the compliance changes. This is one group where the compliance increases slowly. And then there's another group where the compliance is found only towards the end of the capacity. Or there is an abrupt increase in plateau. These patterns help the doctors to decide what type of problem is causing the disease. Then what we look for is what is called the unstable detrusor muscle contraction. The detrusor muscle is the muscle which makes the bladder contract. And normally the bladder muscle should contract only when the patient is trying to pass urine. So if it contracts before that, these contractions can be recorded. And they occur if there is a long-standing obstruction. Say if there is a prostatic hypertrophy which causes obstruction for a long time, then these muscles become irritable and they start contracting. Or if there is any neurological problems, they also become irritable and present as unstable contractions. And then finally, we also look at the post-void residue. After passing urine, how much urine is left behind in the bladder. So this also will give an indication of what causes it. Like if there's a neurogenic bladder or a cauda equina syndrome, or any mechanical obstruction, sometimes medication. All these things can lead to increased post-void residue. The problem with this is that the effective capacity of the bladder is reduced. For example, if the actual capacity is 500 ml and after passing urine, 100 ml stays back in the bladder, the effective capacity is only about 400 ml. And if bladder fills at 100 ml per hour, instead of 5 hours, it will fill within 4 hours. And again, it causes infection because normally bladder has some bacteria which double every 20 minutes. So each time if there is a post-operative residue, post-void residue, the number of bacteria keeps increasing at the start, and when it doubles, it can reach a level which can cause serious infection. So CMG is a very good test which gives a lot of useful information to identify what causes the problem and also give effective treatment.